Welcome, everyone. We're just going to wait a minute or so for folks to log in, and then we will get started. All right, I have 1201 here in Portland, Maine. Welcome, everyone. My name is May LaRue, and I am the Program Management Specialist on the Training and Education team here at the MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series. This is one component of our tobacco treatment and prevention education and training program, which is sponsored by and brought to you on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. This webinar will be recorded and posted to our website following the presentation. We are offering one continuing medical education credit and one CHES credit for this webinar, which will be sent to those who attend the entire session. In order to claim CMEs, you must have a profile in Cloud CME. If you already do, you will find your credits in your profile within a week of this event. If you do not have a profile in Cloud CME, you can find instructions on how to make a profile in the post-webinar email. For those that are collecting CHES credit, record of your attendance will be sent to NCHEC after the event. Only those who registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive continuing education credit, as we are required to verify those who attended. At the conclusion of today's webinar, an evaluation will appear on your screen, as well as be sent to you via email within 24 hours after the event. We encourage you to take the time to provide your feedback, as it is not only helpful to us in planning our webinar series, but to our presenter as well. Today's webinar is titled Heart Health and Tobacco Use, and is presented by Keith Walker of the MaineHealth Center for Tobacco Independence. Keith Walker is a licensed clinical social worker and a certified tobacco treatment specialist. He has worked as a therapist in the mental health field for many years. Prior to joining the CTI training and education team, he worked on the Maine Quit Link for 10 years. He is also a poet, a potter, and provider of spiritual guidance. Before we begin, we have a few housekeeping items to share. As this is a webinar, attendees will remain on mute to minimize background noise. The raise hand feature is disabled for this event. If you are looking for a more interactive session with opportunities to engage directly with the presenter, we recommend attending one of our standard trainings. Please feel free to submit any questions you have during the presentation using the Q&A box. We will address them as time permits throughout the webinar. While we may not be able to answer every question live, rest assured that all unanswered questions will be collected and responded to in a post-event email. For your convenience, a copy of this presentation will be sent out via email after the webinar. And at this point, I would like to turn it over to Keith.
Thank you very much, May, and welcome to everyone, wherever you may be. I assume probably some of you are from places other than Maine, and it's kind of one of our first wintry days here, so hope everybody's safe and cozy today. So as May said, I'm a member of the training and education team here, and as you could hear from my credentials and experience, if you notice, there was nothing in there about medical training or expertise. So I want to just get that out there to begin with, that my expertise is really in tobacco treatment and in mental health. So I'm presenting this material today really as an enhancement to our work in tobacco treatment and not as a clinical or medical specialist. My purpose is to make this information available because we just don't have time to delve into it in our regular training. So this is really an enhancement to our training program to look more at heart health, the issues where smoking and tobacco use affect the heart and the circulatory system. And we want to make this information available because, as we know, we frequently work with individuals suffering from smoking related cardiovascular diseases. And I just want to be able for us to kind of understand the basics, to have a foundation, and to familiarize ourselves with the terms and the processes that our clients and patients may be encountering who have these diseases. So this is why it's important for us to address the preventable aspects of this disease also. We'll be talking about that as well. So just briefly, we are the MaineHealth Center for Tobacco Independence, which works across the state of Maine to address tobacco use and exposure by means of education, prevention, policy, treatment, and training initiatives. CTI administers statewide tobacco treatment contracts on behalf of the Maine Center for Disease Control and Prevention and the Maine Department of Health and Human Services. So as we gather in this virtual space, we acknowledge that here in Maine, we are occupying the traditional territory and ancestral lands of the Wabanaki people, who for thousands of years have called this place home. We acknowledge their continued connection to the land and are grateful for being able to do this work on their homeland. And we remember their ancestors who were here before us. I also want to make clear that references to tobacco refer to commercial tobacco use, not to sacred ritual tobacco use by American Indian communities. And as this slide says, I have no relevant financial relationships to disclose. So here are the main points that I hope to cover today. We want to explore smoking prevalence and increased health risks associated with smoking and other forms of tobacco use. We want to review cardiovascular related health issues associated with tobacco use. We'll focus specifically on heart disease, stroke, and peripheral artery disease. And I want to describe the benefits of becoming tobacco and nicotine free for individuals suffering from heart issues caused by tobacco use and vaping. And then we want to present some resources to providers on treating tobacco use and engaging tobacco users in recovery. So I want to begin with just a brief overview of the scale of the tobacco epidemic. And I'm sure all of you are very much aware of the serious health consequences caused by tobacco products and its toll on human life. And this is why we're committed to our mission of supporting you and all that you're doing to help stem this epidemic. Tobacco use is the deadliest epidemic, both in the US and around the world. Tobacco use is the leading preventable cause of death in the United States. More than 16 million Americans suffer from smoking-related diseases, and half of all smokers will die an average of 10 years earlier than non-smokers. That's quite a stunning statistic. And every year, 490,000 people die from smoking-related diseases in the US. So think of cities with around 500,000 inhabitants like Miami, Kansas City, or Atlanta. And that's how many lives could be saved each year by removing tobacco use from the equation. And globally, 8 million lives are lost every year, which could be saved, except for tobacco use. So to highlight the health burdens, smoking is, as we said, the #1 cause of preventable disease and death worldwide. And we're focusing on heart health today. But as you can see, smoking is implicated in many cancers and chronic diseases, including 90% of lung cancer deaths and 80% of deaths caused by COPD. And I did a recent webinar on lung health. So if you're interested in that area, you can find that on our website. But as you know, cigarette smoke contains more than 7,000 chemicals, and at least 69 of those are known to cause cancer. So we know that smoking harms every organ and every system of the body. So we'll be focusing on the heart today and the circulatory system, but it affects the entire body, as I'm sure most of you know. So when looking at the health burdens of cardiovascular disease in particular, which is our focus for today, cardiovascular disease is actually the largest cause of death in the United States, killing more than 800,000 people every year. 1/3 of those deaths from cardiovascular disease are directly due to smoking tobacco and to secondhand smoke. And that again, that represents 267,000 deaths that could be prevented in a tobacco-free America every year. People who smoke fewer than 5 cigarettes a day may already show signs of cardiovascular disease, and the risk only increases with the amount smoked each day. Smokers not only have more heart attacks and strokes than non-smokers, but they also have them at a much younger age. So smoking significantly increases the risks of cardiovascular disease. The risk of having a heart attack is double in smokers and tobacco users. The risk of having a stroke is also doubled. The risk of having peripheral artery disease is 5 times higher. The risk of dying from heart disease is 3 times higher. And the risk of sudden cardiac death is 3 times higher. And we also know that, unfortunately, women who smoke have a 25% higher risk of developing heart disease compared to men who smoke. And if you're like me, you're probably curious as to why that is. And from what research I could find, there's really no definitive answer. There are some hypotheses, some research done. For one thing, we know that it may have a hormonal link, that smoking decreases estrogen, and estrogen is protective of blood vessels. And we also know that women have somewhat narrower blood vessels than men, and that could also be a factor along with other genetic factors. But as I say, we don't have a really definitive answer as far as I can tell. So what is cardiovascular disease? What do we mean by that term? And it's kind of a broad term that encompasses all types of diseases that affect the heart or the blood vessels. It includes coronary heart disease, which is disease related to clogged heart arteries, the arteries that actually feed the heart. And this is what causes heart attacks. And cardiovascular disease also causes stroke, heart failure, and peripheral artery disease. So heart disease is a catch-all phrase for conditions affecting the heart's structure and function. So all heart diseases are cardiovascular diseases, but not all cardiovascular diseases are heart diseases, which we'll get into in a little bit more detail. Primary example being stroke, which occurs in the brain, but it's related to the vascular system. So coronary heart disease is the narrowing of the blood vessels that carry blood to the heart. Hypertension, as we know, is high blood pressure, which is related to heart attack and stroke. A heart attack occurs when blood flow to the heart becomes blocked and the heart muscle becomes damaged or dies. Stroke occurs when blood supply to the brain is blocked or when a blood vessel in the brain bursts, causing parts of the brain to be damaged or die. Aneurysms are a bulge or weakness in an artery, and peripheral artery disease is a narrowing or blockage of peripheral arteries in the arms or legs. And heart failure occurs when the heart cannot pump blood efficiently enough to supply the oxygen that the body needs. So that's just a brief overview of the different types of cardiovascular disease that come under that umbrella term. So we're going to focus now specifically on the one that we're probably most familiar with, which is heart attack. Heart attack is also called myocardial infarction. And this happens when a part of the heart muscle doesn't get enough blood. And the more time that elapses without treatment to restore the blood flow, the greater the damage to the heart muscle. Coronary artery disease is the main cause of heart attack. Arterial blockage or atherosclerosis may have no symptoms in the early stages. When an artery is narrowed by over 70%, a person may experience muscle pain or cramping when the tissue needs more oxygen than it's receiving. And just as an overview, about every 40 seconds, someone in the US has a heart attack. So we know, I'm sure from our own personal experience, from not only patients and clients, but friends and family, and perhaps some of us ourselves may be aware of that. The following images are just to help visualize what actually causes a heart attack and what happens when a heart attack occurs. So this is an overview of the major coronary arteries that supply blood and oxygen to the heart. And when we talk about coronary artery disease, These are the blood vessels that we're referring to. So the underlying cause of a heart attack is the buildup of plaque. And plaque consists of fatty deposits along with some other compounds that cling to the walls of coronary arteries. And when the plaque thickens and becomes unstable, it can rupture. And this causes clotting or thrombosis. And that is the first stage in the development of a more serious cardiovascular disease in the heart. When the clot continues to grow, the blood flow to the heart becomes restricted, and that can actually begin to cause the death of muscle tissue in the heart. And in this next image, you can see here's where the clot has enlarged to the extent that the artery is actually completely blocked. And without oxygenated blood, the muscle tissue below the point of the blockage begins to die. And this is what we call a heart attack. So what is the treatment? The treatment for a blocked artery is angioplasty, which is a minimally invasive procedure that widens the artery. A catheter with a balloon tip is inserted into a blood vessel via the arm or leg and guided into the blocked artery. The balloon is then inflated, which presses against the arterial walls to widen it. And then a stent, which is a small metal mesh tube, can also be inserted into the artery to keep it open. And the stents have a polymer coating that slowly releases medication to prevent the artery from narrowing again. And the types of medications are what are called anti-proliferative agents, and their function is to prevent the proliferation or the rapid multiplication of these cells in the artery walls. So that is an overview of heart attack, and now we'll shift our focus over to what is a stroke. And a stroke is a disease that affects the arteries leading to and within the brain. A stroke occurs when a blood vessel that carries oxygen to the brain is either blocked by a clot or it bursts. And when that happens, the part of the brain that cannot get blood and oxygen begins to die. There are two different types of strokes. There's the ischemic stroke, which is when a clot obstructs the blood flow to the brain. And this is by far the most prevalent type of stroke that accounts for about 87% of all strokes. The second type of stroke is a hemorrhagic stroke, and this is caused when a blood vessel ruptures in the brain, and this prevents blood flow to the brain, and it also causes a bleed, which causes pressure, and that pressure of the blood in the brain itself or within the brain cavity can damage the brain as well. So what causes strokes? Well, first we'll look at the ischemic stroke, which is caused by arterial blockage, or the buildup of those fatty deposits, the plaque on the blood vessel walls. So these deposits can cause two different types of blockages. The first is called a cerebral thrombosis. And a cerebral thrombosis is a thrombus or a blood clot that develops at the site of the plaque buildup within the brain. And usually these occur at a point where the blood vessel branches and there's a narrowing. And that's where the clot forms, and that's where the blockage occurs. The second type is a cerebral embolism, and that is a blood clot that forms elsewhere in the body, often in the heart or in large arteries of the upper chest or the neck or other parts of the body that moves through the circulatory system and travels through the brain until it reaches a vessel that is too small to let it pass. A primary cause of embolisms is a type of irregular heartbeat you're probably familiar with called atrial fibrillation or AFibs. And this just to help visualize, this is an illustration of the ischemic stroke on the left, which is a blocked artery where this deprives the brain cells of oxygenated blood. And the hemorrhagic stroke, where you sometimes hear this referred to as a brain bleed or a bleed, resulting from a burst artery in the brain, which causes internal pressure and damages the brain tissue. So we're going to look a little more in detail at what is a hemorrhagic stroke or bleed. And this occurs, as we said, when a weakened blood vessel ruptures. There are two types of weakened blood vessels that can cause a hemorrhagic stroke. These are aneurysms, which is sort of the ballooning of a blood vessel until it begins to weaken. The other is called an arteriovenous malformation, which is where blood vessels are in an abnormal configuration, which is inherently weak and susceptible to bursting. The most common cause of hemorrhagic stroke is uncontrolled high blood pressure. Hemorrhagic strokes are a ruptured blood vessel that bleeds into surrounding brain tissue, accumulating, causing damaging pressure. The bleed can occur, as we said, within the brain or between the outer and inner layers surrounding the brain. In both cases, that pressure is ultimately what damages the brain. So just to look a little bit more at aneurysms, they generally form at the branching points of arteries and are caused by the constant pressure from blood flow. They can enlarge over time and become weaker as the blood vessel expands like a balloon and becomes more fragile. People aren't usually born with aneurysms. They can occur at any age. They're most common between the ages of 30 and 60. And again, they're more common in women than in men. And the two most important risk factors are high blood pressure and smoking. So again, we're going to focus on the role of tobacco use in these diseases. So just again, a quick overview of stroke. 795,000 Americans will have a stroke this year. And stroke is the number 5 cause of death in the US, causing 142,000 deaths each year. So I want you to remember, thinking of stroke, this FAST, fast. So F is face drooping. If one side of the face is drooping or numb. A is arm weakness. If one arm is weak or numb. S is speech difficulty. If speech is slurred. or if the person is unable to speak or difficult to understand. And T means it's time to call 911. T, time is of the essence. Quick treatment means less brain damage. There's some excellent clot busting medications now, but they must be given within the first 4 to 5 hours to lessen the chance of disability. So now we're going to shift our focus and look at peripheral artery disease, which is a little less well known, a little less frequent, certainly, but it is also caused by narrowing or blockage of blood vessels, generally in the arms and legs. And the narrowing and blockages are, again, caused by the buildup of plaque in the arteries, or atherosclerosis, excuse me. And peripheral artery disease can occur in any blood vessel, but are most common in the legs. And again, why are we focusing on these diseases? And we're going to get more into that in a minute, but smoking and tobacco use plays a huge role in the damage to the arteries and the buildup of these plaques that cause all of these diseases. So again, to focus again on peripheral artery disease, what are some of the symptoms? First could be weakness, muscle weakness, hair loss, generally again on the legs, smooth, shiny skin, skin that is cool to the touch, and decreased or absent pulse within the feet. Sores or ulcers in the legs or feet that don't heal, and cold or numb toes. And what are the risk factors? Well, again, the top of the list is smoking. Also high blood pressure, atherosclerosis, diabetes, high cholesterol, and people who are over 60 years old. So now let's talk a little bit about vaping and cardiovascular disease. We're going to talk also about combustible tobacco products. We know that smoking is known to be a primary source of the cause of these diseases. But vaping, we're beginning to find out, is also a significant risk factor with cardiovascular disease. Vaping is, as we know, the act of inhaling the aerosol from an e-cigarette or similar device. And the term is used because e-cigarettes don't produce smoke in a combustible sense, but rather an aerosol. And the aerosol is often mistaken for just water vapor. Some people still believe that it's just water vapor, but it's actually an aerosol that consists of a number of fine particles. And many of these particles contain varying amounts of toxic chemicals, which have been linked to heart and respiratory diseases and to cancer. So we know that vaping, which was once thought of and hoped to be a safe alternative to other tobacco use, unfortunately, is definitely not. Vaping can have several negative effects on the cardiovascular system. First, it causes increased blood pressure and heart rate. It causes an immediate uptick in blood pressure and heart rate, similar to the way that smoking traditional cigarettes does. And it creates damage to the blood vessels. The long-term use of e-cigarettes can impair the function of blood vessels, which, as we know, increases the risk of cardiovascular disease. This includes making the arterial walls stiffer and less elastic. It also reduces the capacity to exercise. And we know that people who vape tend to perform worse on exercise stress tests. The increased risk of blood clots are caused because vaping, again, changes the lining of the blood vessels, making them more prone to develop blood clots and fatty buildup, which causes heart attack. And we have also found some concerning new evidence. There are two new analyses from research comparing cardiovascular function in people who vape, people who smoke, and people who did not use any nicotine. And they found significant negative health impacts, both among those who vape and who smoke combustible cigarettes. The new evidence shows that people who use e-cigarettes consistently perform worse on treadmill exercise measurements that predict heart risk, as we mentioned. And it also creates a negative impact on cardiovascular function among the people who vaped at a rate that was similar to the impact on people who use combustible cigarettes. So it's not only present, but it's actually at the same level or a similar level to those people who smoke. And even those who used e-cigarettes, even though they were younger, and even though they had vaped for nearly 2 decades less than the group who smoked, they still showed significant signs of cardiovascular damage and risk for serious disease. So these are some very concerning signs related to vaping. And we know that when you combine e-cigarettes with smoking, which unfortunately happens quite often, people will be using both products together intermittently. We know that both of those can cause problems, but when they are combined, the risk is higher than using either product alone. So it's an increased risk for those who both smoke and use some form of vaping. So in the studies, it was found that chronic e-cigarette users had impaired blood vessel function, which may put them at increased risk for heart disease, and indicates that chronic users of e-cigarettes may experience a risk of vascular disease similar to that of chronic smokers. So just to reiterate that information, which I have to say was new to me as an increased risk factor of vaping. So how does tobacco use actually contribute to cardiovascular disease? Well, we know, as we said earlier, that it causes a spike in the heart rate and blood pressure, which we know have negative impacts. Smoking also produces carbon monoxide, which deprives the heart, the brain, and the arteries of oxygen. And we know that harmful chemicals in smoke and in vape make the blood itself more sticky. And the stickier the blood, the more likely it is to form clots. And we've already seen the role of clots in both heart attacks and strokes. It also lowers the capacity for physical activity, and we know that that's essential to keep the heart and the cardiovascular system healthy. And smoking also decreases the HDL, or the good cholesterol that helps protect from cardiovascular disease. And it raises the level of triglycerides, which contribute to cardiovascular disease. So as we said, smoking cigarettes can cause cardiovascular disease by changing the blood chemistry. And those changes in the blood chemistry can cause that plaque, which is that waxy substance comprised of cholesterol, scar tissue, calcium, fat, and other materials that build up in the arteries, causing blockages um, and blood clots and embolisms. And when chemicals in cigarette smoke thicken the blood in the arteries, it becomes more difficult for blood cells to move through the arteries. And that also adds to the creation of blood clots that ultimately can lead to heart attack and stroke. Smoking also increases the stiffness of blood vessels, making it more difficult for them to expand and contract without being damaged, and makes it more likely that they can split, causing a hemorrhage. So these changes in the arteries can lead to, as you can see, heart attack or stroke. And we also know that unfortunately, secondhand smoke exposure also causes heart disease and stroke. And just to harken back to what we looked at earlier, just as a reminder that, 1/3 of those 800,000 deaths from cardiovascular disease each year are directly related to tobacco use. So we've been focusing a lot on the risks of tobacco use and the damage it can do to the heart and the brain and the circulatory system, and certainly don't want to minimize those. And obviously, we don't want our clients and our friends and our family who use tobacco to be exposed to these risks. And, those of us who work with people, or even those again, just our friends and family, it's very tempting to use this information in a way to sort of try to scare people into stopping. And, if only that worked, but unfortunately we know from research and experience again and again that almost all tobacco users are well aware of the risks, and most know they need to stop and want to stop using these dangerous products. So it's important not to, add to the stigma, because they often already feel a sense of anger toward themselves, some despair at not being able to quit, and self-blame for causing their illness. They often have a strong desire to change, but they may not know the most effective ways to recover from tobacco use. The most common method that people use to try to be tobacco free is still cold turkey, and that has only a 4 to 7% chance of success. So most people really may not be equipped to know the best ways to try to recover from this addiction. So I know in our other trainings, we go into a great deal of detail about the importance of counseling and medications to help people that can significantly increase the chances of quitting. But one number I want you to have, if you don't already know this, because people often feel very discouraged because of previous unsuccessful attempts. And the average number of attempts before becoming tobacco free is actually 30, which is a lot higher than I ever imagined before I was in this field. But I also want to really accentuate the good news, which is that with every single attempt, we know that the likelihood of success increases. So with every attempt, regardless of the outcome, they are closer to being tobacco free and to significantly uh, benefiting their health. And we're going to talk more of that. The health benefits are really significant in terms of cardiovascular risk. So it's really important to emphasize with people, and again, this is some really positive news to share with people, because I found that a large number of people were not aware of the benefits. They had the risks pretty well hammered into their heads, but that wasn't enough to help them quit. But sometimes knowing the benefits is a really positive additional incentive and motivation. So the benefits of being tobacco free actually start within minutes. Within 20 minutes, the blood pressure and heart rate drop. Within 12 hours, carbon monoxide levels return to normal. And in just 1 to 3 months, circulation improves. And in just 1 year of being tobacco free, the risk of coronary heart disease is cut in half. So that just 1 year of being tobacco free, and the risk is half that of a smoker. So that's a huge, huge benefit. And there are more. Within 5 years of being quit, the risk of stroke is the same as a non-smoker. Within 5 years, that risk is completely taken down to the risk of a non-smoker. And in 15 years, the risk of any coronary heart disease is the same as a non-smoker. It also reduces the markers of inflammation and that increased stickiness of the blood, which causes, as we know, the risk of arterial blood clots. And it actually improves that HDL, good cholesterol, and it reduces the development and progression of atherosclerosis. And becoming tobacco free at an early age, by 40 years of age, actually has a 90% reduction to the increased risk of death due to tobacco use. So the benefits are really tremendous when it comes to cardiovascular disease. So again, what are the best treatments? And again, as we said, we know the gold standard is to combine counseling or coaching, any type can be over the phone, face to face, even online, digital services. All of these can be successful. And tobacco treatment medications. And we know that both of these can be effective by themselves, but when you combine them, we know that's even more effective. So combining counseling and medications. So we have a lot of material about counseling and medication in our trainings and on our website, but just a quick overview. We know that tobacco treatment medications have been around for a long time. They're safe, they're very effective in helping to treat tobacco use disorder. And by decreasing withdrawal symptoms, they more than double the rates of becoming tobacco free. The primary medications are nicotine replacement products, which I'm sure you've all heard of: the patch, the gum, the lozenges. They're also come in the form of nasal sprays and inhalers. And again, all of these are FDA approved as safe and effective. And then there's some prescription medications you've probably also heard of, such as varenicline or Chantix. and bupropion or Wellbutrin. These are other prescription medications which have also have a very positive effect for people trying to become tobacco free. So those medications all safe and effective. And if you're concerned about risk and side effects, there's really only one absolute contraindication for those nicotine replacement products, and that's Buerger's disease. And this is a rare disease that causes clotting and blockages in the blood vessels of the arms and legs, hands and feet. And virtually everyone diagnosed with Buerger's disease is actually a tobacco user. And quitting all forms of tobacco is the only way to stop Buerger's disease. And people with this disease actually should not use nicotine replacement therapy because nicotine can keep the disease active. We know that nicotine is a stimulant and a vasoconstrictor, so it causes the blood vessels to narrow. So for people who had a heart attack or a stroke within 2 weeks, or if they have unstable heart arrhythmias or unstable angina, at the Maine Quit link, we would seek the approval of their medical provider before we provide that nicotine replacement therapy. And I can tell you that nearly always providers approve those requests. And in fact, many of the people are already on nicotine replacement therapy right in the hospital because the risk of tobacco users are so much greater than the use of the nicotine replacement products. Now, for some individuals who are having some particular types of plastic surgery, or if they have severe bone fractures, sometimes they may not be recommended to use the nicotine products also. Again, because of the vasoconstricting aspect of nicotine. There is, however, a lot of misinformation about the overall safety of nicotine and nicotine replacement therapy, because some people believe that it's the nicotine that causes cancer and other diseases, when actually the carcinogens and the toxic chemicals in the tobacco smoke, in the aerosols for vaping, those are the things that cause tobacco-related illnesses. So you may be wondering, okay, so where can people find treatment and medication? Some of you are already providers, and we are so grateful for that. But for those of you who may be new to this, the good news is that every state has access and to a range of services that can be reached just by calling 1-800-QUIT-NOW. The Maine Quit link offers a variety of options, including telephone counseling, free nicotine replacement therapy, online support and resources. We also have tailored programs, an American Indian commercial tobacco program, and a tailored youth program called My Life, My Quit. So all of those programs you can check out on our website at MaineQuitLink.com, and it can be reached at 1-800-QUIT-NOW. If you don't live in Maine, be sure to check out your own state's Quit link. Those services, again, are available in every state in the U.S. So these are a list of some of the resources that I pulled from in putting together this overview of cardiovascular disease and tobacco use today. And as I said, I know this is foundational for some of you who are in the medical field. I'm sure this is very elementary, but for some of you who, like myself, are uh, working with tobacco as tobacco treatment specialists, not as medical providers, um, I hope this information will be helpful and useful to you as you work with clients, patients, and again, understanding even what family and friends may be going through when they talk about having cardiovascular disease, heart attack, stroke, peripheral artery disease, and these other things that we know are preventable. And hopefully, it's become also clear the tremendous benefits that can be derived by becoming tobacco free and giving you a little look at the resources that are available to help in that process. So, um, thank you very much um, for your time and your attention. And I see we have a few minutes left. If you have any questions, I'll be glad to try to answer them, or we'll try to get them answered for you.
Thank you so much, Keith. We do have a handful of questions that have come in, and I don't think we're going to have time to get to all of them. So, again, rest assured, we'll get you answers and send those out with the post webinar email. But I will start with a couple questions, Keith. So, the first one I have here, once the heart tissue begins to die, is it reversible with treatment?
Again, I am going to have to postpone answering that until we can look into it. I said, unfortunately, uh, I don't know the answer to that. I'm not a medical person, and I didn't come across an an answer to that in my research. So we'll research that and get back to you. Thank you. Excellent question.
Awesome. And then the next one is, can you share the citation or links to the comparison study on the effects of cardiovascular health for different types of tobacco, including vape?
Um, yeah, we'll be glad to do that. Absolutely. Yeah.
We can link that in
Yeah.
the post-event email for you.
Yeah. Yeah.
And let's try one more, Keith, before we close up with some reminders. How about, are the benefits to quitting vaping similar? Do we have those studies yet?
That's a really good question that I do not have the answer to. Um, and I don't know if we have research on the benefits yet, but I think it's safe to assume that there definitely would be similar benefits to being vape free as tobacco free. But I no, I don't have the research to back up that assumption.
No problem. And we have a couple comments, people thanking you for the great information. Um, and I'll give folks another 20 or so seconds to type in any final questions.
And as May said, we'll definitely do some additional research, and if we can find answers to these questions, we'll definitely forward them along to you. Thanks again so much for all you're doing out there to help people be healthy.
Great. Thank you so much, Keith, for such a wonderful and informative webinar. Once again, everyone, this webinar was recorded and will be posted to our website. In order to claim CMEs, you must have a profile in Cloud CME. Instructions can be found in the post-webinar email. For those that are collecting CHES credit, it will be sent to NCHEC on your behalf after the event. You will also receive all of this information and a copy of Keith's slide deck in the post-webinar email. Additionally, an evaluation will appear on your screen once the webinar is closed. Please take the time to provide your feedback. If you have any questions, please feel free to contact us via the email that you see on your screen, and we thank you for your participation today. Take care.